Bird flu, also known as avian influenza, is a viral infection that primarily affects birds but can sometimes infect humans and other animals. It is caused by influenza type A viruses, with the most well-known subtypes being H5N1, H7N9, and H5N8. Brief history of bird flu in Nigeria. Nigeria was the first country in Africa to confirm the presence of bird flu, with the virus first detected in Kaduna State in 2006. The disease has re-emerged in 2015, 2017, 2018, and 2021. In 2007, Nigeria recorded its first human case of avian influenza fatality that affected a 22-year-old female in Lagos State. Recent outbreaks. In 2024, an outbreak was confirmed in Kano State, with authorities highlighting the heightened risk of transmission. In 2025 now, new cases of highly pathogenic avian influenza were confirmed in Kaduna State. The World Health Organization (WHO) has stepped up its support to the Nigerian government to prevent transmission of the virus to humans following the alert of a highly pathogenic avian influenza outbreak in Kano State. Impact and concerns. Bird flu poses a significant threat to both animal and public health. The disease can cause the loss of millions of birds and income for people who rely on the poultry industry. The escalating costs of poultry feed also pose challenges to the industry. Farmers are advised to keep their poultry isolated and report any sudden deaths to the nearest veterinary clinic. The Bird Flu Watch initiative aims to empower farmers with knowledge and resources to prevent the spread of avian influenza, human cases. While the virus spreads rapidly among birds, it also has the potential to infect mammals, including humans. The risk of human-to-human transmission is currently low, but scientists are concerned that it may change if the virus mutates. Symptoms in humans can include fever, cough, sore throat, difficulty breathing, and conjunctivitis. Key facts: transmission in birds spread through saliva, nasal secretions, and feces. It spreads rapidly in poultry through direct contact or contaminated environments. Symptoms in birds: sudden death without signs, swollen head, comb, or wattles, respiratory distress, drop in egg production, diarrhea, and lethargy. Preventive measures to combat bird flu in poultry farms is to enhance biosecurity measures to contain the spread of avian diseases by the following. 1. Limit visitors. Only allow essential visitors, for example, vets, suppliers, after disinfection and proper farmware change. 2. Use disinfectant foot baths at all entry point and ensure workers sanitize their hands. 3. Clean and disinfect transport vehicles before they enter the farm. 4. Regularly clean poultry houses, feeders, drinkers, and equipment with disinfectants. 5. Raise birds in batches and avoid mixing ages to reduce disease spread. 6. Have a quarantine area immediately separate infected or exposed birds. 7. Proper disposal of carcasses immediately to prevent disease spread. 8. Store manure away from poultry houses and cover it to reduce fly and odor problems. 9. Follow a strict vaccination program based on local disease threats. Litter management. Change bedding regularly to prevent ammonia buildup. What to do if you suspect bird flu? Use protective gear when handling birds. Avoid consumption of sick or dead birds. Isolate and report immediately to veterinary or agricultural authorities. Bird flu remains a serious threat to poultry health, livelihoods, and even human health. Early detection, rapid response, and strict biosecurity are the most effective tools in preventing its spread by staying vigilant. Training staff and working closely with veterinary authorities, farmers, and communities can protect flocks and reduce the risk of outbreaks. Together, through responsible farming practices and collective surveillance, we can safeguard our poultry industry and public health from the dangers of avian influenza. Ellico Agravet, home of agriculture to the world.